You're a pioneer in new products and procedures, and you're one of the first 2 people to have used Botox as a cosmetic use here, as well as the CO2 laser. That is pretty exciting. So I'm curious, how did you get your patients to jump on the bandwagon of putting botulism in their face for a cosmetic procedure?
You know what, Sheila, it's a stranger story than that. You make it sound like it was just, 1 or 2. But in 1993, there had been no media exposure for Botox. That came in 97, 4 years later. I tried to pitch the idea to my patients, and they said, "What? You want to put what? It's going to do what?" And truly, I did lose. I actually lost a few patients who thought I was, as you can imagine,
Sure.
There's only 2 people, on the West Coast that have ever done this, and I'm trying to pitch it to my patients. Well, I did lose a few patients, but those patients came back to me later on and said, "My gosh, how did you know that was going to work out that way?" But it was science, and I went to the University of Chicago because I'm basically a scientist also, and the science was there, and I believed in it. And for those patients that tried it, they certainly did find the results. And 4 years later, in '97, when the media hit, of course, the rest is history. The Allergan company, has a cornerstone of their income based solely on that product now, and you can imagine they only sold one or 2 bottles that first year, and this year, who knows how many they sold.
Oh, that's so true. Boy, that has to be exciting being a part of such an amazing launch.
It was, and the same goes for the CO2 laser. That was the first of the real technologies that were going to be used to get rid of the signs of aging, that is, the wrinkle removal, or to smooth the surface of the skin, short of the old ways of sanding or the sort of rough, coarse sort of treatment. So it was the first use of technology for both enhancement as well as correction. And I'm proud to say that I was involved in doing that, and not only doing some of the initial work with it, but also as part of the Cedars-Sinai division, we set up some laboratories to train doctors to use the CO2 laser. And now there are so many lasers being used for the same purposes, both for cosmetic changes, enhancement, rejuvenation, turning back the clock a little bit for all our patients.
Yeah, well, that's exciting and so empowering for so many women and men out there that are interested and really want to look their very best.
Yeah, it's great technology, and a lot has sprung out of that.